Good morning. This is the Anchorage Emergency Operations Center operational update for 14 July. And Unique Inc. was giving out tattoos for the first COVID vaccines. And situation overview. Go ahead.
Good morning. Today is day 498 of our response. As currently reported, locally, we're up 277 cases in the last week, 3 deaths and 16 hospitalizations. Statewide, up 473 cases, 4 deaths and 24 hospitalizations. Next slide, please. For 213 resource requests, we filled or otherwise satisfied 1,792, an additional 14 since the last report, with 9 currently working. Next slide. In the Sullivan, we have 274 clients. That's down 15 from last week. In the non-congregate shelters, 358 clients, no change. That's 632 clients in all shelters, down 15, averaging 1,896 meals served per day. Next slide. In the last week, at the visit testing sites, there were 2,118 sample collections performed. And in the last week, at all pods, 518 doses administered with 80,859 to date. End report.
All right, thank you, situation. Weather, go ahead.
Hey, this is Ben with the Weather Service. Yeah, we're looking at a great stretch of a few days ahead here with some of the warmest weather that we've seen all year going through the weekend, and looking at a cool down to some rainier conditions midweek next week. End of report.
Thank you, Weather. Testing vaccinations, go ahead.
Good morning, everyone. This is Pat Ryder, Emerging Infectious Diseases Assistant Program Manager. Today with testing, Visit Healthcare had an increase of 29.53% over the previous 7-day sample collections. Our community cases are continuing to increase. As of July 11th, our estimated daily growth rate is 5.35%. Our 14-day average reproductive rate is 1.238, and our 14-day average case rate is 9.31 for every 100,000 residents. Our current alert level is intermediate. With vaccines, Visit Healthcare clinics had an increase in average daily vaccination of 16% from the previous week. We are currently downsizing all 4 Visit Healthcare clinics. Our Janssen vaccine supply is currently limited. We have the following for pop-up vaccine clinics. Today we have yoga in the park at the Delaney Park Strip. Tomorrow we have the Spinard Food Truck Carnival and Charlie's Produce. On Friday we have Enlace's Mobile Consulate, the Muldude B&G Club, Anchorage Cider House, and Matanuska Brewing. On Saturday, we have Enlace's Mobile Consulate, Turnagain Brewing, Salsa in the Park at Delaney Park Strip, the Bear Paw Festival, and Matanuska Brewing. On Sunday, we have the Bear Paw Festival and Matanuska Brewing. And on Tuesday, we have the Spinard Food Truck Carnival. Just a reminder, we do have mobile vaccine clinics that can come to you wherever you are, be it a business, church, or other organization. For more information or to schedule, please dial 907-531-5100. Next slide, please. With respect to messaging from the Anchorage Health Department, as mentioned, our overall risk level is intermediate. This is evidenced by the increase in cases for the municipality to a rate of 9.31 cases for every 100,000 residents, as well as the 24% increase in new resident cases from last week. That said, with approximately 57% of eligible residents ages 12 and older and 59% of residents ages 16 and older having completed a COVID-19 vaccine series, Anchorage comprises 2 subpopulations with very different COVID-19 risk profiles. Unvaccinated individuals currently experience a risk for COVID-19 infection equivalent to an average daily new case count of approximately 12.8 for every 100,000 residents, while their vaccinated counterparts experience a risk equivalent to only 1.9 for every 100,000 residents. Our consensus reproductive rate of 1.238 is similar to last week's consensus of 1.20. A reminder that a reproductive rate above 1 indicates that the virus is continuing to spread. Finally, we do continue to watch the following community factors which may increase COVID-19 risk within the municipality. These include an increased prevalence of more transmissible variants of concern, including the Delta variant, very slow increases in vaccination coverage, minimal use of non-pharmacologic interventions, including masks and social distancing, and high numbers of travelers to Alaska for both employment and tourism. This concludes testing of vaccines. Barring any questions, end of report.
Thank you, sir. Next up, contract logistics. Go ahead.
Good morning. We are currently wrapping up contracts that were approved during the 7/13 Anchorage Assembly meeting, and we're continuing mass shelter support through September the 30th. The COVID testing contract bids were due back on 7/7. The current contract is extended through 7/16, and we're working on the extension through 7/31/2021. We're continuing with ongoing staff adjustments to meet COVID mission and requirements. End of report.
Thank you, ma'am. Finance. Go ahead.
Good morning. This is Carrie Wiedeker covering for Audrey Malone, Finance Section Chief. Currently, the EOC has encumbered $23,156,592. Our actual spent to date is $66,380,818 for a total of $89,537,411. The Office of Emergency Management does continue to seek cost recovery for expenses by way of FEMA public assistance. Invoices for the EOC still need to be sent to eocinvoices@anchorageak.gov. End report.
Thank you, ma'am. Public information. Go ahead.
Good morning. This is Public Information Officer Heather Orono. Wanted to let you know about some of the things that we've been working on. So you saw in an earlier slide some photos from a pop-up vaccination clinic hosted by Unique Inc., a tattoo shop in Anchorage. These folks that are in our photos came in for their first vaccination. They got a tattoo of up to $50 value as an incentive to come in. Sounds like things were busy and fun, so we'll see if other opportunities like this come up. We're continuing our outreach to the community about vaccination clinics and COVID rates, as well as just any testing locations that are available. We are promoting the upcoming clinic at O'Malley's on the Green, and always looking for other businesses and organizations interested in hosting pop-up clinics. We also have a radio spot coming up on Thursday, July 22nd. Mix 103.1 is going to be having PIO Laura Atwood on to discuss upcoming vaccination clinics and vaccination status in Anchorage. Barring any questions, end of report.
All right. Thank you, ma'am. Liaison officer. Go ahead.
Good morning. This is Drielle Welch, COVID lead and acting liaison officer for the Anchorage EOC. Thanks to all of our partners who were able to join us today. We'll get started with our hospitals. A&MC was not able to make it this morning, so I have posted their numbers. They have 6 COVID positive patients, 3 in the ICU, 2 on ventilators, and 2 COVID positive recovered inpatients. Alaska Regional.
Just to say, Alaska Regional Hospital has 15 COVID positive patients, 3 of whom are in the ICU.
Thank you, Sean. So Providence did report their numbers. They have 20 COVID positives, 6 of which are in the ICU, 6 are on mechanical or non-invasive ventilation, and no reports of PUIs or COVID recovered. They did mention, though, that this is about double where they were last week, and they have had to start turning down some requests to transfer COVID patients in due to capacity limits. And then Kara for Matsu Regional.
Good morning, it's Kara from Matsu Regional Medical Center. We currently have 1 positive COVID patient, none in the ICU or on vents, no PUIs. Just preparing to start seeing an increase in numbers like the other Anchorage facilities. Thank you.
Thank you, Kara. And that's all for liaison. Thank you.
All right. Thank you, ma'am. And as a reminder, our next operational update briefing will be 10 o'clock on the 21st of July. Everybody have a great week. We'll see you then.